Welcome back, everybody. Today we're going to be doing a deep dive on something that you guys specifically requested,
Oh, cool.
which is taking a closer look at this APO B test.
Okay.
It seems like a lot of you are already, pretty savvy about, keeping tabs on your health.
Yeah.
So we're going to go beyond just, the usual cholesterol checks.
Right.
And we're going to be exploring this APO B test, which is gaining traction as potentially being like a better predictor of heart disease risk than the traditional lipid panels.
Absolutely. And what's really fascinating about it, I think, is that it doesn't just focus on, how much cholesterol you have,
Oh, interesting.
but it really focuses on how that cholesterol is being transported through your bloodstream.
Okay.
So it's like understanding the difference
I
between,
like that.
okay, a packed delivery truck and a sleek sports car,
Okay.
both carrying cargo,
Okay.
but with very different implications for traffic flow.
I am intrigued. Okay.
Yeah.
So tell me, what exactly is this APO B test measuring? And why should someone who is already health conscious
Yeah.
care about it?
That's a great question. So the APO B test is specifically measuring the levels of Apolipoprotein B 100 in your blood,
Okay.
which sounds very complicated.
It does.
But think of APO B like those tiny delivery trucks we were talking about.
Okay.
Each one carries a single particle of LDL cholesterol. And that's the kind that can build up in your arteries and increase your risk of all those heart problems.
So instead of just getting a total cholesterol number,
Yeah.
this test is actually counting the number of bad cholesterol carriers in my system.
Exactly. And that's why it can be a more precise measure of risk, especially for those people who are already taking steps to manage their heart health.
Okay.
Traditional cholesterol tests can sometimes be a little bit misleading,
Oh, really?
particularly for individuals with metabolic syndrome or diabetes.
Wait, why is that?
Yeah,
I thought just keeping your LDL cholesterol low was the main goal,
right.
regardless of anything else.
Yeah, so it's a bit more nuanced than that. You see, LDL cholesterol isn't all created equal.
Interesting.
There are different subtypes.
Okay.
Some are smaller and denser than others.
Okay.
And these small, dense LDL particles are actually more likely to get stuck in your arteries and then contribute to that plaque buildup.
Oh.
So the APO B test takes this into account by directly measuring the number of those bad cholesterol delivery trucks in your system,
I see.
giving you a much more accurate picture of your actual risk.
So for someone like me,
Yeah.
who's, already eating a healthy diet and exercising regularly,
Right.
could this test still reveal something new about my heart health?
Absolutely. Even if you have healthy cholesterol levels overall, the APO B test can reveal whether you have a higher proportion of those small, dense LDL particles, which could still pose a risk.
Gotcha.
So it's like looking under the hood and seeing what kind of engine is powering your cholesterol levels rather than just checking the fuel gauge.
That's a great analogy. It seems like this test could be especially useful for people who are already proactive about their health and, want to fine-tune their approach.
Yeah.
But let's talk about logistics.
Right.
What's involved in actually getting this test done?
So it's a simple blood test
Okay.
that can be ordered by your doctor,
Easy peasy.
and you don't even have to fast beforehand
Oh, perfect.
unless you're getting a full lipid panel at the same time.
Okay, so no need to skip my morning coffee.
Yeah.
All right. But what kind of results can I expect to see, and what do they actually mean?
Right. So the results will show your APO B level, which is measured in milligrams per deciliter.
Okay.
And generally for men, a normal range is between 66 to 133 milli-GDL.
Okay.
For women, it's a little bit lower,
Yeah.
between 60 to 117 milli-GL.
Gotcha.
But what's really important is understanding how your individual result relates to your overall risk profile.
So higher numbers mean higher risk, right?
Exactly.
But what if my levels are on the higher end?
Right.
Should I be worried?
So a high APO B result isn't a reason to panic, but it's definitely a signal to take action.
Okay.
It means there's room for improvement, and it gives you and your doctor a much more precise target to work towards.
This is starting to make a lot of sense.
Yeah.
It's not just about a single number, but about having a more detailed understanding of how my body is handling cholesterol.
Exactly.
That's great.
Yeah.
I like it.
Right.
So let's say my APO B levels are higher than they should be.
Okay.
What are the next steps? Is
Yeah.
it just about making those general lifestyle changes that we always hear about?
It's true that, diet and exercise play a huge role in managing your cholesterol. And that's certainly part of the picture here.
Yeah.
But knowing your APO B levels allows you to be much more targeted in your approach.
Okay, so how does that actually work?
Right.
Give me some specifics.
So, for example, studies have shown that a diet rich in soluble fiber can be particularly effective in lowering ApoB levels.
Okay.
So think oats, beans, lentils, fruits like apples and pears.
So it's not just about cutting out saturated fat,
Right.
but also actively adding in these cholesterol-lowering foods.
Exactly. And when it comes to exercise, high-intensity interval training, or HIA, has been linked to significant reductions in APO B.
Interesting. I've been meaning to try HII anyway.
Yeah.
So it's like having this extra motivation, knowing that it could directly impact those pesky cholesterol delivery trucks.
Precisely. It's about empowering you to make choices that specifically address your individual risk factors.
Now, I know you mentioned medication earlier.
Yes.
Where does that fit into all of this?
So in some cases, lifestyle changes alone might not be enough to get those APO B levels down to a healthy range.
Okay.
And that's where medications like statins can be incredibly effective.
Mm-hmm.
They work by blocking the production of cholesterol in the liver,
Okay.
essentially reducing the number of those delivery trucks rolling off the assembly line.
So for some people, medication could be the key to really getting those numbers down.
Right.
But I imagine there are other options too, right?
Yes, there are other classes of cholesterol-lowering medications like PCSK9 inhibitors
Okay.
that can be even more powerful than statins.
Wow.
They work in a different way by helping your liver clear LDL cholesterol from your bloodstream more efficiently.
So it's like having a whole fleet of tow trucks
Yeah,
to clear out the cholesterol traffic jam.
that's a great way to put it.
I like that one.
The key takeaway here is that you have options.
Yeah.
And having a clear understanding of your APO B levels helps you and your doctor make the most informed decisions about which approach is best for you.
This has been so informative.
Okay.
I'm starting to see how valuable this test could be, especially for someone like me who likes to stay ahead of the curve when it comes to my health.
Absolutely.
But I do have one question.
Sure.
You mentioned earlier that the APO B test might be particularly helpful for people with diabetes
Yes.
or metabolic syndrome.
Right.
Can you explain a little more about why that is?
Of course, individuals with these conditions often have a higher proportion of those small, dense LDL particles we talked about.
Okay.
Their cholesterol profile can be more complex, and traditional cholesterol tests might not always capture the full picture of their risk.
So the APO B test provides a more accurate assessment in those cases.
Exactly. It cuts through the noise and gives you a more precise measurement of the actual number of LDL particles circulating in the bloodstream, which is a more direct indicator of risk.
This is fascinating.
Yeah.
It makes me wonder if this test could eventually become a standard part of routine health screenings,
Right.
even for people who don't have any specific risk factors.
That's a great question, and one that's being debated in the medical community right now.
Yeah.
Some experts believe that the APO B test provides such valuable information that it should be included in routine blood work for everyone, regardless of their current health status.
That makes sense. After all, prevention's always better than cure, right?
Exactly. Early detection is key.
Yeah.
And knowing your APO B levels could potentially help identify individuals who are at risk before any symptoms even appear. On the other hand, there are some who argue that wider screening might lead to unnecessary anxiety and medical interventions
Right.
for people who are otherwise healthy.
That's a valid point.
Yeah.
It's all about finding the right balance between proactive screening and avoiding unnecessary medicalization.
It's a complex issue with no easy answers.
Yeah.
Ultimately, the decision of whether or not to get the APO B test is a personal one, and it's important to discuss the potential benefits and risks with your doctor.
I completely agree. It's all about having a conversation with your healthcare provider.
Yeah.
And deciding what's best for your individual needs. This has been like a truly eye-opening deep dive into this world of APO B testing.
It has been.
Yeah, and it's clear that, this test offers a level of detail and insight
Yeah.
that goes beyond, what we traditionally think of when it comes to cholesterol.
Absolutely. And what's so exciting about it is that this knowledge empowers you to take much more targeted action to protect your heart health. It's not just about lowering a number. It's about understanding those nuances of your individual cholesterol profile
Yeah.
and making choices that directly address those specific factors.
It's like having a roadmap
Yes.
to navigate your, heart health journey
Exactly.
with more precision.
Yeah.
Instead of just following, these general guidelines,
Mhm.
you can kind of pinpoint the areas where you need to focus your efforts.
Exactly. Whether it's incorporating, specific foods into your diet or trying a new exercise routine or talking about medication options with your doctor, you really have the information you need to make the most informed decisions.
So for our listener who, is clearly passionate about optimizing their health,
Yeah.
what would you say is the key takeaway from our deep dive today?
I think the most important message is that knowledge is power.
Yeah.
especially when it comes to your health.
Mm.
The APO B test is just a prime example of how a simple blood test can unlock so many insights that can empower you to take control of your heart health and make choices that align with your overall wellness goals.
It's about moving beyond that one-size-fits-all approach and embracing like a more personalized understanding of your own individual risk factors.
Exactly. And remember, this is just the beginning of your exploration.
Yeah.
Don't be afraid to ask questions.
Hmm.
Seek out information and engage in open conversations with your healthcare providers about, your needs and concerns.
It's about becoming an active participant in your own, you know, health journey,
Yeah,
armed with the knowledge and tools to make informed decisions every step of the way.
absolutely. And as always, the world of health research is constantly evolving. So stay curious, stay informed, and stay proactive when it comes to your heart health.
Well said. Now, for our listener who has been with us on this fascinating deep dive,
Yeah.
hope you're feeling empowered and inspired to, explore this further.
Absolutely. Remember, this information is meant to be a starting point, a catalyst for you to have those more informed conversations with your doctor
Yeah.
and make choices that, feel right for you.
And with that, we will wrap up this deep dive into the world of APO B testing.
Awesome.
We hope you found it insightful and empowering. Until next time. Stay curious and keep seeking those hidden gems of knowledge that can make a real difference in your life.